I think I have a prolapse. What could I be experiencing and what can be done about it? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. We're breaking down prolapse, and since it's such a big topic, we've been doing some Ed Talks and breaking down the different types of prolapse and treatment options. In this edition, we are talking about RECTOCELE, which is a prolapse of the rectum. Here I'm going to show you on our female model just a recap of the pelvic organs. Here is the pelvic, here is a female pelvis. So we have from the front, behind the pubic bone, the bladder, the uterus, and the rectum there. So a posterior vaginal wall prolapse is referred to as a rectocele when the rectum comes down and is not in the expected position up high. So what are some of the symptoms that you might be experiencing if you have a rectocele? Number one could be poor control of gas, where you feel like you're trying to hold back gas, but some just kind of sneaks out without you meaning to. Another symptom could be leaking stool. So you might notice that you actually have some accidents. You might notice some smearing in your underwear, or even having to wipe and wipe, like you feel like you never completely get clean after having a bowel movement. Another sign could be strain with bowel movements. You may have difficulty emptying your bowels completely, where you just feel like you never really get that good bowel movement where you feel like you're done. You might even feel like constipation. And another common thing that happens with rectocele is women report that they have to insert their fingers, say vaginally, in order to help have a complete bowel movement where they're actually lining up the stool with the rectum, because otherwise it kind of comes forward into that vaginal space. Next, we're going to talk about just some conservative treatment options. Now, this isn't all inclusive, but I want to give you some options from a pelvic floor physical therapist standpoint that can be really helpful if you are experiencing a rectocele. One is exercise. And really with that, learning how to manage the pressures down into your core, down into that pelvic area so that you're not increasing that pressure and causing more damage. The form of exercise that I like to do is low pressure fitness. It's a really great way to help lift up the organs and to provide strength and flexibility to the area. Another treatment option is pelvic floor training. And while the pelvic floor is part of the core, it's not the only thing. So even with exercise, we want to look at how strong are the legs, how strong is the abdomen and the back to help support as well. With pelvic floor training, it's about strength, but also coordination. We want to make sure that the muscles actually work in the way that they're supposed to and at the timing that they're supposed to. Another treatment option is just manual physical therapy, actually using our hands in order to do some work from the outside and maybe even from the inside into the vaginal space. And occasionally we actually do some work around the rectum itself. A PESSARY is another really good conservative treatment option. It's just something that can be inserted into that vaginal area and help to give some support to the organs. Modifications to, say, lifting and just those daily things like picking up baby and kind of moving around, just making sure that you're breathing properly. And with that, even looking at your posture and addressing any strain that the body might have, or like, say, weird posture positions that might be contributing to the rectocele. Another treatment option could be supportive garments. Something like these Spanx are really good to help give some support into that pelvic area and some compression. Even honestly, some nice good compression leggings can be very helpful for some people. There's also this product here. It's called a FemJock. It actually goes on under your clothing, but over top of your underwear. And this can give some really good support into that perineal area or down below. If you're watching this and any of this resonates with you and you think, you know what, I haven't been diagnosed, but I suspect that maybe I have a rectocele, we would be happy to be that source of information for you. The best place to start is head to our website, healingspotpt.com, and fill out a form there to request a discovery session. Sit down with me face-to-face or via video and get any of your questions answered. Thank you for watching this Ed Talk.